Hello and welcome. Idiopathic scoliosis has been a puzzle for doctors for, well, decades. But what if the answer wasn't in the spine at all? Today, we're going to dive into a pretty radical new method that looks at the body as one big interconnected system to treat the spine. So let's just jump right in with a huge question. What if we're looking at scoliosis completely backwards? What if that curve in the spine isn't actually the cause of the problem, but just a symptom of an imbalance happening somewhere else in the body entirely? All right, just to make sure we're all on the same page, the magic word here is idiopathic. It basically means for no known reason. And that's the central mystery we're exploring today, along with a new approach that's trying to finally solve it. And this brings us to a completely different way of thinking. Instead of zooming in on just the bones and muscles of the back, this method zooms way out, looking at the whole human body as this one single integrated system. And this quote from Dr. Yongsub Lee, who's the author of our source material, really gets to the heart of it. The main idea is that nothing in the body ever works in a vacuum. A tiny, seemingly random adjustment, even to just one finger, can create a ripple effect that travels through your entire body. What's so interesting here is the contrast, right? The conventional view is very local. It sees a problem in the spine and it tries to fix the spine. But the HGMT view is, well, global. It's this idea that to fix a local problem, you have to understand its place in the global system of the entire body. So the key to this whole global approach comes from the concept of meridians, which is drawn from Korean medicine. Think of them like the body's internal communication highways. They're this invisible network that functionally connects your arms and legs directly to your torso. So a signal sent from your ankle could, in theory, travel right up that highway and influence what's happening in your back. Okay, so if the body is one big connected system, how do you actually use that to treat scoliosis? This is where all that theory turns into a very hands-on method. Let's take a look at how it works. It's called HGMT, which stands for Hyunga Manual Technique, and at its core, it's a type of manual therapy. But here's the twist. Instead of working directly on the person's back, it uses these really targeted exercises on the arms and legs to correct the trunk's alignment. And the type of exercise is absolutely key. So the process is pretty straightforward. First, you identify the exact shape, the specific pattern of the spinal curve. Second, you apply a very specific isometric exercise to an arm or a leg. And that just means you're creating tension in a muscle without actually moving the joint. Through those meridian pathways we just talked about, that targeted tension sends a corrective signal all the way back to the trunk, which helps realign the spine. It's totally indirect, but it's also incredibly precise. And this, wow. This quote from a patient really shows you the kind of impact this can have. This person felt like other treatments were just about damage control, just trying to stop things from getting worse. But this new approach actually offered them a path toward improvement, changing the whole goal from just halting the problem to actually getting better. But here's the thing. To apply the right exercise, you need a really accurate map of the problem. A generic diagnosis just won't cut it. You need a whole new way to classify the curve itself. And this is where the JESU5C classification system comes in. The name itself is actually a mnemonic, which is pretty clever because it encodes all the different curve patterns. It's basically a new, much more detailed language to describe the specific shape of a scoliotic curve after analyzing x-rays. And I know it might look like a random jumble of letters and numbers, but these aren't random at all. Each one represents a distinct, recognizable shape that the spine has formed, everything from a simple J or C curve to a more complex S pattern, and even patterns that are named after the number 5. So in total, we're talking about more than 6 main pattern types. And having this level of detail is what allows therapists to finally move away from a one-size-fits-all treatment. It lets them create a highly systematic and personalized plan that's based on the body's own unique structural signature. Okay, so this is where it all clicks together. The super detailed map you get from the JESU5C classification directly tells you which HMGT method to use. It turns all this complex theory into a really practical path to correction. It's a simple idea, but it's also an incredibly powerful one. A precise diagnosis should lead to an equally precise treatment. No more guesswork. The shape of the problem literally dictates the shape of the solution. And here's exactly what that looks like in practice. As you can see in this table, If an X-ray shows an S pattern, the protocol points to a specific technique tied to a meridian point. In this case, it's the Yongsub point on the wrist. If it's a long C pattern, there's a totally different corresponding exercise, this time on the leg. Every diagnosis has a direct, specific therapeutic partner. And this is why it all matters. It creates a system that is both completely personalized and standardized. The treatment is tailored to the individual, but the method for getting there is repeatable and based on really clear diagnostic rules. It's kind of the best of both worlds. And I want to be clear, this isn't just some abstract idea someone dreamed up. It's a fully developed system that's been used with patients for years, it's been detailed in a published book, and it's even led to patented technology, like a corrective suit designed to help reinforce these patterns. So the big takeaway here is really this final, kind of provocative thought. The source material suggests that even though the human body might seem chaotic and unpredictable, maybe there's a hidden order inside it. Perhaps this systematic approach to scoliosis is just one example of that, of finding a logical pattern where we used to only see random dysfunction. It really challenges us to look past the symptom and start to understand the underlying system.